So I'm going to be talking about discharge information for patients that had a liver transplant. So um, start off by, before discharging the patient, they need to have a date and time to come back. And it's important to let them know that they should plan on coming back 2 times a week for the first several weeks. Medication is something you need to stress. It's very important to take all the medications as prescribed, and you should let them know that they should become knowledgeable about what the medication names, the dosages, and the side effects too. It's a good idea to maybe have them keep a med diary or a medication journal, just to help them keep track until it becomes kind of like a normal habit. I mean, you're gonna have to take medication for forever. And it's important to stress hand hygiene. A lot of people don't think about washing their hands before taking medication, but especially with a liver transplant, you want to reduce the risk of infection as much as possible. So any type of bacteria going into the GI tract could potentially cause harm. So there are some main guidelines that should be followed. And I have them kind of on the front of my packet that I would, just so they could kind of always flip back. It's a lot of information. So I want, it's good to have that written document for them to refer to. So always wear a medical bracelet. So in case of an emergency, it's known to medical personnel that you have had a transplant. You want to avoid people with colds, flu, or people who just don't feel well until they don't show any symptoms. You want to avoid crowds and crowded rooms. Stay away from areas under construction. Pets are a big thing after a liver transplant. Up to date on all their shots. Make sure they're always going to the vet vigilantly. And birds are not recommended. Their waste has a high level of germs, and you really shouldn't handle any pet waste at all. You want to make sure you keep clean, good self-hygiene. Wash hands after the bathroom, before meals, and like I said, before medications. You want to wash all fruits and veggies. There could be bacteria on the skin that could also go into the GI tract, and like I said, you want to reduce infection, the risk. Do not smoke. Immediately wash a cut or a scrape with soap and water, and if it's not healing, that's also something that needs to be addressed to the doctor. So then when you turn the page, there's a few more. Check with doctor before receiving vaccines. Stay away from daycares. Report any blisters, sores, lumps, or growths. And you want to discuss travel. Traveling to underdeveloped countries is really just not advised. Another thing to teach is the signs and symptoms of infection. So fever of above 100, swelling or tenderness over the new liver, flu-like feelings, clay-colored stools, dark tea-colored urine, and a late sign would be jaundice, which is yellowing of the skin or the whites of the eyes. You want to contact the doctor if you have any signs or symptoms of infection. You also want to contact the doctor if you're weak or you get tired easily, fever, headache, shakiness, painful or tender abdomen, or around the wound area from the incision. If your legs begin to swell, or if your skin's itchy or there's a rash, you need to call your doctor for that too. And a life-threatening emergency, so you should call 911 or get help immediately. If your arms or legs feel warm, tender, painful, swollen, or red. If you're urinating less or not at all. If you have a high fever, shaking, chills, black tar, there's a whole list. Lightheaded, shortness of breath. A whole list for those patients. Now, before we get into the medication, because that's going to take a little while to go through, and I'm sure they'll have a lot of questions. Another thing that you need to stress is dental care. It's very important to brush your teeth after every meal, daily flossing, and gum stimulation. Usually before the dentist, too, it's good to let them know that they'll need antibiotics, usually like amoxicillin, or if they have an allergy, clindamycin. You want to take that 1 to 2 hours before the dental procedure to avoid infection. Then you take the second dose 6 hours after the first dose. When it comes to sexual relations, sexual relations may resume 4 to 6 weeks after surgery. For women of childbearing age, it's good to let them know that birth control should be used because ovulation can come back before they actually start their cycle starts regulating. So you want to use barrier methods when you've had a liver transplant. So like condoms, diaphragms, and sponges. The IUDs carry too high a risk of infection, the intrauterine devices, too high of a risk. And oral contraceptives like the pill can actually affect liver function. So with a liver transplant, you shouldn't use those. In case of men, some of them may need Viagra afterwards. It doesn't interfere with any of the medications needed after a transplant, but still should consult your doctor if you're having issues with that. And it's really important to know like signs of rejection and the signs of infection, and it's good to know those because the quicker that treatment is received, the more successful it will be. There are other things that could occur, such as pneumonia, which is a lung infection. It's important to follow the exercise program that's given by PT afterwards, and report any phlegm or blood brought up when you're coughing, whatever comes up from the lungs. Bactrim or Septra may be prescribed to prevent a certain type of pneumonia, pneumocystis carinii. It's dangerous and it occurs in patients with decreased immune system. And a lot of the medication that is taken for treatment after a liver transplant does suppress the immune system. It weakens it. So sometimes they will use those to help prevent that. UTIs are another common problem. So you should report any sign and symptoms such as burning pain while urinating or frequent need to urinate. Also, there are some fungal infections that could occur in the mouth, throat, or throughout the body, in the blood. The greatest risk for that is the first 3 months after the transplant. So medications would be like nystatin, swish and swallow it, or if it's a vaginal infection, use like a monostat suppository, things like that. Just good to keep track to make sure none of that's happening. And again, it's all because the medication does weaken the immune system a little bit. Some viral infections such as herpes can also occur, which is inflammation of the skin with some small blisters. So there's two types, herpes simplex. It's like a cold sore, and it can occur around the mouth or the vagina. And herpes zoster, which is shingles. So it's just like the chickenpox. It appears along the distribution of a nerve, and it's usually in the face or the chest or the abdomen. So usually after the transplant, you'll be prescribed Zofirax, which is acyclovir, to prevent herpes after the transplant. Another, which could be CMV, and it can occur in the liver, lungs, eyes. Rarely it can occur in the brain. So before the transplant, you'll get evaluated. You would have gotten evaluated for the antibodies as well as the donor liver, and if they did show CMV antibodies in that evaluation, medication and dosage would vary based on how high of a risk that was. You want to make sure you're taking care of properly of your wound. Again, noticing any signs of infection like redness, tenderness, swelling, any fever. You want to maintain physical therapy. That'll help improve movement and strength, and it also will decrease pain. You want to prevent blood clots with exercise. Walking helps prevent this. Prevent blood from pooling in your legs and causing clots to form inside the veins. So just don't overdo it. Make sure PT lets you know how much exercise you should be getting. Another thing is pressure stockings. They're like long, tight stockings that put pressure on the legs, and it helps promote blood flow, and it prevents clots. It's important not to drink alcohol as it can damage the new liver. You want to make sure you maintain a healthy weight to help decrease the risk of liver problems as well. Eat healthy foods, so nutrition is a good thing to talk about as well. It'll help increase energy and help heal faster. These foods include like fruits, veggies, whole grain breads, low-fat dairy, beans, lean meats, and fish. And it's important to protect the skin too. A lot of people don't think of that, but after the transplant, you have an increased risk for skin cancer. And also, the medications that you can take can also increase the risk for sunburn. So it's good to recommend sunblock 40 SPF or higher, and have a yearly exam to check your skin. You also may need a vaccine to prevent Hep A and Hep B, because that can occur, as well as a flu shot every year in around October or November. And then when we get into the meds, so it's just good to let them know the name of the medication, the dosage, the side effects, and what the medication does. So really quickly, the Neuro, which is a cyclosporine, it's given to prevent rejection of the transplanted liver. It must be taken every 12 hours. The dosage may change depending on blood levels. And again, let them know the side effects and contact the doctor. Do not stop taking the medication, though. That's a good stressor. Don't stop taking it. Just let the doctor know. Prograf is used instead of Neuro, never together. Again, that one's taken 2 times a day, 12 hours apart. Again, always let them know that these medications are going to suppress their immune system. Prednisone also helps to prevent rejection. It's a steroid used along with Neuro. You'll gradually be tapered off this medication as the function of the new liver increases. It's taken 1 time a day, and it's a 5 milligram tablet. And again, let them know the side effects of that medication. Solumedrol, which is methylprednisone. It's IV prednisone. You're never going to use it along with prednisone. It gives it a large dose if a rejection occurs, and then you taper that down as function increases. You start the prednisone again. Salicept, MMF, myosiphenolate mofetil. It's another anti-rejection medication taken along with Prograf or Neurol, along with the prednisone. It's a capsule taken every 12 hours, 2 times a day. Again, let them know the side effects. OKT3, that's an IV medication only given for severe rejection. So it's an antibody that kills specific white blood cells that are involved in the rejection process. So it's only giving if the rejection doesn't respond to if it doesn't respond to the prednisone. And it's given 1 time a day for 7 to 14 days. And that's one that's given under close supervision because the side effects can be serious, such as wheezing, shortness of breath. I mean, some people don't have any side effects. And there are other side effects that are listed on this chart as well. But Tylenol, Benadryl, and Solumedrol may be given prior to each one of these doses to decrease the incidence of side effects. So after discharge, the patient has the responsibility for maintaining their health and avoiding rejection. Again, importance in hand hygiene, personal hygiene, wound care, and just making sure taking medications, knowing those medications, maybe keeping a diary to keep track of those medications, and noticing any signs of rejection or infection. And it's a lifestyle change, and it will take time to adjust, but hopefully a guide like this and with the right patient teaching, we can, let our patients be aware.